I've always had degenerative issues. I've always had rheumatoid arthritis. I've had issues as long as I can remember as a child. My hips and my knees have always given me issues. When you're walking, your knees get swollen, they're in pain, your hips ache, hurt. You can't go anywhere without having that. If it meant getting a new knee, I would get a new knee. And if it meant getting a new hip to avoid pain, I would get a new hip.
I take people that have arthritic hips and knees and help them get back to enjoying things that they want to be able to do in life. We have a couple of different parts of the practice, all revolving around hip and knee replacement. A young active person here, because they don't have any cartilage left, we can replace that and get them back onto their life rather quickly, uneventfully. But we also have another part of our practice which may be even more satisfying, and that's the people who have had joint replacements and they're no longer functioning for whatever reason, infection, worn out, broken, or their ligaments have just stretched out. But for a multitude of reasons, I call them the island of misfit toys, these people need to be reconstructed. And that reconstruction is often much more difficult, and maybe that's why it's more enjoyable. So Barbara came to me with a few different problems that we're able to correct surgically on joint replacements that had been done and failed. She's had rheumatoid arthritis, and that destroys the joints in your body and often results in early joint replacement. So what happens? Those joint replacements get done early, you live life and you wear them out, then they fail. One of the reasons that I find operating on people with rheumatoid arthritis so fulfilling is these are people who have lived with chronic pain their entire life. You can see in the view to your right here, this is the femur, this is the actual knee joint, and what's happening here? This is loose and it's no longer in the tube. It's starting to work its way out. How can you walk like that? Think about it. If you have a loose tooth, that's painful. Could you imagine having a loose femoral component? By converting her from a loose implant that may have a little bit too thick of a plastic insert, bringing her joint line to where it belongs, reestablishing normal anatomy and normal biomechanics, guess what? She's back to enjoying life and really being an active woman.
Well, it has been 5 months out since my last surgery on my knee. I just completed my first ever 5K walk. I did walk because Dr. Stolarski didn't want me to overdo it. I would have never ever thought that I was able to get it healthy enough to walk like that again. I have been very fortunate to have Dr. Stolarski and his staff. I do think they are the best. I wouldn't be able to be the best that I'm able to, try to be. So I want to thank them for being the best doctors that I could have.
If you look at the data, 1 in 5 people are unhappy with their total knees. That's a horrible number. So I think with appropriate patient selection, the right operation, the right technology, that number, in our practice anyway, is much better. But if you're one of those 1 in 5 or 20% of painful knees, your life's not over. You don't just have to throw your hands up and accept it. I often hear, oh, my doctor said my x-rays are perfect. X-rays are only part of the problem, right? Your x-rays can be perfect, but there's ligaments and soft tissue and the rest of the person to look at, right? Look at their hip, look at their back, look at the knee. So the x-rays don't tell the whole story. And oftentimes, when a doctor is looking at a total knee that's been replaced, they don't have the experience or the training to really evaluate the knee appropriately to see what can be fixed to make it better, to get them back where they need to be.